So Plamotamab is another bispecific antibody that joins some of the other ones that are currently being studied, such as mosunetuzumab, glofitamab, epacretamab, odronextamab. So this one, how was the study? This is a very large study actually that started several years ago, evaluating several dosing of this medication. So as it's been consistent with most CD20, CD3 bispecific antibodies, this is given in a very regimented step-up dosing fashion to reduce the incidence of CRS and neurotoxicity. Currently, as a study, it was originally designed as a phase 1 study. We enrolled several different subtypes of non-Hodgkin lymphoma in several different cohorts. What we were able to demonstrate in the original initial phase 1 study, which is currently being evaluated in a expansion cohort in follicular and DLBCL, is that this antibody is effective in patients with multiple relapsed diffuse large B-cell lymphoma, follicular lymphoma. We also have some responses in other NHL subtypes such as marginal zone lymphoma and mantle cell lymphoma. What we've seen is even in some patients who are post-CAR T, we've seen some patients have very good responses, even some complete remissions. So at this point right now, the study is really moving into sort of an expansion phase where we have a recommended phase 2 dose. And what we would hope to sort of demonstrate with the recommended phase 2 dose is get a true baseline of the efficacy and obviously get more safety data to compare this to some of the other bispecific antibodies that are on the market. So just to be clear with the dosing schedule for this one compared to some of the other ones, because they all have very different dosing regimens. This one, as currently with the phase 2 expansion, will be given weekly until we reach the recommended phase 2 dose, and then we'll be given every other week as an IV infusion. So moving forward, obviously, like I said, it'll be really just evaluating the efficacy at the recommended phase 2 dose given every 2 weeks, and it will be given until disease progression or intolerance.